all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials. Good morning to our Q100.7 family. Good to be with you, and we're back. Yes, officially. We're back with the QEH Pulse Radio Show. I'm your host, Shane Seeley, and it's my pleasure to tell you that we'll be with you for at least the next 10 weeks to share all of the updates, all of the latest news, activities, and really everything happening at our hospital. It has been my pleasure to do this for 4 seasons previous. We had so much to discuss, so much to share with you. Of course, we always want to hear from you as well, and we'll give you that opportunity to call us. Recently, we would have had some public engagement, and we wanted to do that before we got back here with you on the radio show. That public engagement was our public town hall, where we invited members of the public in person and online to get a glimpse, really more than a glimpse, to see the 2025 to 2028 strategy in its entirety, get an idea of where we are at, what is happening, and what is to come. And of course, the public was given the opportunity to share their proposals, give us their thoughts about the service, and what are some of the things that they want to see included in the strategy. Of course, leading the strategy, that 2025 to 2028 strategy at the hospital, is our Chief Executive Officer, Neil Clark, who is here with me. Good morning, Mr. Clark.
Good morning, Shane. Thank you for having me back here again.
Always a pleasure to have you. I have no choice, and I wouldn't have it any other way, because it's all about making that strategy move from vision to the vision that we had for it overall, the vision that you would have painted along with your executive team, and turning it into action. And you did say that you would not be back here unless there was some action and a lot of news and activities and some fruit to show for all that work that you have put in. So we're seeing the tree bearing fruit, yes, so to speak.
For sure, nobody wants to write a strategy that sits on the shelf, and that was never our intention. So we spent a good year working on year 1 of that strategy, and it was right that we went back to the public and said, here's the progress that we're making. So it was a great event. A lot of people turned in for that event, both online and at the QEH, and we're really grateful for those who take the time to give us their feedback and let us explain what we're doing to them.
Indeed. And we spent over 2 hours doing that. Not only, of course, sharing that strategy, but getting the feedback as well and hearing some of their concerns and suggestions. What are some of the things that stood out for you? What were you happy about in terms of that engagement that we had in that town hall?
It's always good to take the directors, the executive leads to these events and explain what they've been doing with their teams, because I think it gives them an opportunity then to say, look, we have been busy doing lots of things, and it allows them to share that with the public and for the public to hear that. Communication, which is your area of expertise, Shane, is a challenge always. No matter how much we communicate, we don't always get heard by the right people in the right way at the right times. So to have the opportunity to directly allow the directors to speak to the public about what they've been doing over the last year was really important. And at the end of the presentation, to get the questions and the feedback was equally important, because it helps me understand what the priorities are for year 2 of the strategy implementation.
This is year 2. Is it, or do you consider it an extension of year 1? I know 2025 to 2028, it didn't start January 2025. So where are we now?
We're at the start of year 2, so financial years. So in April 2026 is the start of year 2 of the 3-year strategy.
Okay. What are those successes, those action points that we have delivered on under this strategy that you're proud of?
So those who tuned into the actual town hall would have heard that, and Shane can also let you know where the YouTube page is for that, so you can listen
Indeed.
to the whole show again. But some of the obvious big things for us are we've implemented the linear accelerator, and that linear accelerator now has delivered more than 1,500 treatments for the patients and the public of Barbados, with over 100 patients completing their treatment, significantly also reducing the waiting times for first outpatient cancer appointments, helping patients begin their treatment sooner, have that treatment closer to home, surrounded by their loved ones, and at the same time actually saving money for the taxpayers of Barbados by not having to send the patients abroad for treatment. So that's probably one of the probably highlights that we've had over the year. A lot of you will know too then we're also on the health information system agenda. We're digitising the health system at the Queen Elizabeth Hospital. So far we've digitised over 4 million pages of medical records, over 75,000 records completely digitised. We're rolling out the software of the health information system. We're training the staff on how to use it. They're working with the team who's here on the ground, implementing the software as we get ready to go live on that software. And so that's an exciting piece of work that's coming as we start to build up the information. And as we build into the electronic patient records and have that real-time information, it's important to remember that the digital improvements that we're doing at the QEH isn't about having computers on desks. It's about having timely access to health records and about being able to see information immediately and being able to get real-time information. So I often say that digital transformation isn't about digital, it's about how we improve the healthcare system as a whole. That's an exciting and very big piece of work that we're doing. Along the side of doing that, we're also going to be digitising the health HR team. So all the HR records, nearly 3,000 staff on manual paper records, we will digitise those, and we'll be moving towards some improvements and digitising some of the pathways and processes that are still manual in the procurement and the finance arenas. So lots going on in the digital agenda in as well. You will have heard that we got 295 new posts. The vast majority of those new posts have now been filled. So the vast majority of those posts have been filled, which helps strengthen the services and supports the patient care journey. We got 130 million capital expenditure funding, which is an excellent support for the hospital to enable us to replace a high number of items that are aged in the hospital. Nearly 2,000 items are progressing through purchase orders. Nearly 50 million of that money is already spent as we start replacing part by part the different aged equipment within the hospital. And in addition to that, then you'll have all heard about the new $400 million ENMO development, which has been built across the road from the QEH, and that piece of work's starting already. We're moving out the teams.
Yeah.
Teams are being moved out to different locations for the next few years to enable those builds to happen, and which is a challenge for the teams to make sure they can continue to maintain the services whilst they're off-site and dispersed into multiple locations. And at the back of the hospital, you'll have heard about the new Queen Elizabeth Rehabilitation Centre that's being developed. You'll have heard also about the new incinerator or waste management system, a green waste management system to improve how we dispose of waste in a green manner. So there's so much happening at the QEH, so much going on.
All at one time. The QEH, we at the QEH are very busy, and we're happy to be so, because it is better to continue to improve the services. At times, there will be some inconvenience. I know some people have been heading over to the phlebotomy department. That has been relocated from the Enmore site, and it's now over at the Queen Elizabeth Hospital's annex, and that's at the corner of 6th Avenue, Belleville, on that Belleville Main Road stretch, on that Pine Road stretch. You'll find the phlebotomy department there, and a number of other departments which have been moved thus far, and we will keep you updated on those departments which have been and which are being relocated from the Queen Elizabeth Hospital, which you or patients or visitors will have to interface with from time to time. You can always go to our website, QEH Connect, www.qehconnect, to see all of the updates, so you can find out exactly where they're moving. But we will also share it right here on Q100.7 FM and in other spaces on social media as well. Remember, you can call us today at 434-1007 or 434-1070 for the WhatsApp. You can send those WhatsApps to 434-1007, and of course you can listen live to us at cbc.bb on Q100.7. The link is right there on your website. So much to talk about. We have a caller to the program, our first caller for season 5. Welcome. Good morning. How can we help?
Morning. Peace be unto you and yours.
Hi, how you doing?
To the staff and to all listeners and to your distinguished guests.
Yes, Mr. Clark is here, the CEO.
I went out this morning early, and I heard some good news from a lady. She said, well, the mother was there too. She said the ambulance had to come for her, and she got good service. So that is number one. And what I had called you about, you just said that is about going to
phlebotomy.
Yeah, to get your bloods and things. Because I didn't know that it moved, and I saw a gentleman there too, and he said he rang. So I was asking him for Mr. Hope, and he told me that there's 2 places. So he don't know Mr. Hope, but it moved now, and it gone in the 6th Avenue. So yes, I like to let people know, because I didn't know, and it seems like a lot. Who was there among us said they didn't know that it moved either. So thank you for that. And my promise is still up, but I'm a person that I care about people, and I had to travel to go and seek something. I would like the church in Dominica to do for my adopted dad, so I wasn't here for a little while, but I will call you. I tried calling you, but you wouldn't answer the phone, Shane. So please, when you see my number come.
I was probably on vacation. I had some vacation.
Too many vacations.
Oh no, only one.
So as soon as I get the stuff, all right.
That's no problem.
The promise is a comfort to a fool.
That is no problem.
All right. So I wasn't here for a little while. I went to get business done.
All right, that's okay.
All right, take care. God bless Barbados, and I want a good system in this country. So I want you and all the others to do your best, especially for those who cannot afford to pay.
Yeah,
and it's really tough.
That's how Mr. Clark is leading us with this strategy.
And you know what's really helpful is when we hear these comments, these positive comments about the hospital, and the staff there are all working so hard to try and deliver this world-class hospital for the public of Barbados.
Well, sir, one time this country, we were the guiding light of the Caribbean.
Yes.
I feel bad to hear when they see things happening. Not that I hate my country or I criticize my country, but we want the best.
And we have.
If you don't speak about certain things, it won't happen. It ain't that you hate the country or you hate the government or whatever. But if you got a healthy society, you got a productive country. So we need a good health system.
For
and
sure.
I thank you very much, sir.
Thank you.
Jan. Take care.
No problem. You be good. Thank you so much for sharing that comment with us, especially about the ambulance service. We are glad that that individual got the treatment that they needed in a timely fashion. We know that our ambulance service does their best serving the entire country to make sure that they reach the patients where they are, to ensure that they can provide that life-saving treatment in many cases.
And it's really good to get this positive feedback, because the staff do thrive off that, and there is no reason in my mind why the QEH can't reclaim its place as being, a true centre of excellence, because already a number of the services within the QEH are centres of excellence that we should be truly proud of. But we accept that there are still some challenges that we need to address, and we will be working diligently to address those challenges and make everybody who works at the QEH proud to work there, and everybody who uses the QEH proud of that service.
A work in progress indeed. We'll take a break here, but when we come back, we got a lot more to share with you on this edition, the first show for season 5 of the QEH Pulse Radio Show, right here on your favorite station, Q100.7 FM.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Back with you on the Pulse Radio Show. I'm Shane Seeley, Communications Specialist at the Queen Elizabeth Hospital. With me is the Chief Executive Officer, Mr. Neil Clark, who leads the strategy along with his executive team. And when I say strategy, the strategy for the hospital 2025 to 2028. And you got a bit of a snapshot in the start of the show about what has been happening, what are some of those action points that we've been able to realize, and what are some of these success stories, those great stories coming out of the Queen Elizabeth Hospital. Before we speak a bit more about the strategy and what else it contains and what else you can expect in terms of service delivery at our hospital, let's go back to the phone lines very quickly. Remember, you can call us 434-1007 and 434-1070. Good morning, caller. Welcome. How can we help?
Good morning to you, Shane, and Mr. Clark as well.
Good morning. How are you doing this morning?
I am fine. I am excellent, actually.
Perfect.
A couple of weeks ago, Shane, I spoke to you about my treatment in the E01. I had a minor stroke, and my treatment, I would say, again, was exemplary. So there's no problem there. And I want to thank Mr. Clark for the form that he would have had in the past couple of weeks, and again, making himself available to come on here so the public of Barbados can see what are the plans, what's going on, and how we are going to be dealing with the hospital going forward. But on our last conversation on air, I spoke to you about a minor issue that I had with the seating.
Yes, you did. I remember that.
You remember that? And I know you are a very result-oriented kind of person. So I would like for you to enlighten me as to what has transpired since our conversation and what is in the plans for those kind of things. Because actually, yesterday I visited a friend, and she is, what shall I say, she's a full-body person. And again, with those chairs, with the double armrest, it was, like fitting a really close fit. So I would just be interested in hearing what are the plans to address that situation. But again, I must say I'm absolutely pleased with what has been going on and the changes that I've seen. So what I'll do, I just put down and listen for you.
Thank you very much for calling and reminding me as well. One of my biggest flaws is that my memory is not the best, and I always depend on callers and those like you in the community who are concerned about others. You mentioned that your service, you receive good service, but you mentioned the concern that is not only would affect you but would affect others, and we really appreciate that. And now that the CEO is here, he can explain his thoughts as we get into speaking about what may be the biggest challenge going forward for the hospital. But the caller there, he would have called a couple Thursdays ago, I think it was, when I was speaking to Joyanne Haig on Let's Talk About It right here on Q100.7 FM, and he was concerned about the seating in A&E, saying that it could be a bit uncomfortable for some. What can we do with reference to that? I know that some recliners would have we would have had some recliners in some areas to make it a bit more comfortable for some who visit and also who are patients at the hospital. But is there anything else that we can do as an institution to provide more comfort in the A&E, especially in the outer waiting area with those seats?
I think we can, Shane, and it's great to hear those feedback coming in. I do know that they were looking at some recliners from the A&E department and different seating arrangements. We would have to check back with the team as to where they've got to with that. So it's really important that people are comfortable whilst they're waiting there. I think also, though, in my mind, is I'm always trying to focus on the cause of the problem rather than the effect of a problem. And people sitting waiting for long times in the A&E waiting area is an effect. It's not the cause of the problem. And in reality is, if we can manage the flow through, then people shouldn't be waiting for a long time in the waiting area of the A&E. They should be flowing through the A&E department, having their triage, seeing the doctor, timely diagnostics, seeing a specialist if required, either being discharged from the A&E or admitted to a ward timely. And I guess that's where most of my effort and most of our effort has been focused on year one of the strategy. And you'll know, and I mentioned this at the town hall, it's been a frustration to me that we haven't made as much progress as I would have liked us to have made. We know that we've been seeing slightly increasing numbers in the A&E department, and we know that we've been seeing increasing complexity within the A&E department, and the waiting times have come down ever so slightly, but nowhere near as much as I would have expected or wanted them to. So that's been a frustration, and I openly admitted that at the town hall, and that's not about blaming the team in A&E in the slightest. It's about system refinement and not people. I fully understand the hard-working staff who are in the different departments trying to make this happen under immense pressure, often in circumstances that the public don't see. But that waiting time challenge is bigger than the A&E department, and it's bigger than the QEE. It's about the whole health system working together. Prevention and primary care support, timely diagnostics and treatments, patient flow through the QEH and the inpatient beds, and better post-acute and community support services to help people safely leave the hospital. So, whilst I've been slightly frustrated and disappointed about the progress we've made on that to date, I do, however, remain confident. And you might ask why. Well, that's because a number of the foundations that will improve the A&E waiting times are now being built, and that they're in place. So despite this personal disappointment, I remain confident that the plans we're putting in place and the dedication of the teams at QEH to improve those waiting times and improve the patient's experience will happen and come to fruition. So I'm saying that this year we will drive again harder at those A&E waiting times and bring those down. And if I can bring those waiting times down, the challenge of sitting uncomfortably in the A&E waiting area will go away.
Would not be the effect from the cause, which is the longer waiting times that are still being experienced, but work is in progress there.
But in the interim, the point's absolutely clear that we have got people waiting in the A&E department, and so we do need to make sure that we can make that as a comfortable wait as possible in the interim.
But improvements nevertheless, and I think that's something that I mentioned this morning on Morning Barbados. It's not perfect, but we continue to step by step make improvements that can signal to Barbados that we as an institution, the Queen Elizabeth Hospital, can improve our delivery of care at that point of care for every patient who comes to our doors. Good morning. Welcome to the show, our next caller.
Good morning. Good morning.
How are you doing?
Not all the good, but thankful.
Thankful is great, but we want to hear from you. How can we help?
I have a problem for over 20 odd years.
20
I
years.
want to know when this problem is going to get solved. Now, you have appointment for this particular date, right? You're going to your appointment, then to be told the clinic is cancelled. No one called to say nothing, no follow up. You just go there, here, clinic cancelled, you got to go back home, get a taxi to come up for you or whatever. This is not fair.
It isn't.
This is something been happening for over 30-something years. I've been going to the hospital with my outpatient, and that's the way it gets sometimes. No clinic, just got to go back home. It's not good.
And that outpatient issue is something that we heard in the public town hall as ready. So you're not alone, and it's something that we do apologize for. It's something that we are working on, CEO.
Yes, absolutely. So we spoke about the A&E weights and the A&E pathways and the work that's happening there. At the same time, we're starting the work on the outpatient pathways and the inpatient pathways. And a lot of this is absolutely right about scheduling of those outpatient appointments, how we're communicating them and how we manage them. And the way we're doing it currently is by no means ideal. And what we need to do is bring together the waiting lists and understand how we're scheduling, and the health information system will enable us to do this. So currently, if you think about what we have a number of outpatient clinics in a number of specialties, all providing these outpatient services. But how we manage and schedule those, there's a science to that. And I want to bring that science here to Barbados to make sure that the people get better outpatient appointments. Supported by the health information.
All it is a call to say that you cancel and don't come. That's a call. Nobody call and say nothing. And you go down there, you got to get taxi up and down. That is money wasting that you don't have. Yeah. All it is a call to say, Miss Brown, Miss Clark, no clinic this day. That's all it takes.
Agreed.
100%. And this is about having that information available to our teams to make sure that they know who to call and when to call. And where we can, automating that. So those of our patients who use their mobile phones can actually get reminders and notifications direct to their mobile phone, reminding them about the appointment or advising them that the appointment's been changed or moved. So you can see that, and we can reschedule those appointments electronically, or you can reschedule your next appointment at a time that's convenient to you. So there's so much more we can do about how we schedule the outpatient appointments and how we manage those, and that's something that we'll be putting more effort into in year 2 of our strategy.
Yes, but in the interim, we do apologize for that inconvenience. Anytime you have a challenge of this nature, please feel free. We want you to call us 536-4800. You have that number, 536?
Yes, sir. I have it. I do call it. I use it for the hotline to get my medication. I do call it.
Yeah, that's 536-4804.
Yeah.
But I want you to call the 001 536-4800, especially when you have an issue like that. Our patient advice and liaison service reps will be able to respond to you and give you some guidance so that medical records would know how better to respond in your individual case. And we always ask individuals, if you have an issue, you're unsure how to navigate, call that number.
I'm a wheelchair user, I have a disability, amputation, and when I got to get a taxi or so, come to me, bring me, and then quick, so I got to call another taxi. It's hard.
Of course, that's not fair to you at all. So we want to correct that. So please, if you can leave your name with the producer here right now. That's Derry Bowen. Please leave your name and your contact information with her, and let us get on to you as well to see how best we can help. But we do apologize for what you experienced, and we aim to do better for you.
Thank you, appreciate it. I will leave the number and name.
Thank you very, very much for calling too. We need to hear this.
And Shane, that's a great example, isn't it, of somebody who the service didn't work for.
Mm-hmm.
It didn't work for her. She came in for no reason, spent the money on the taxi for no reason. And these are things, with the help of the health information system and the availability of information, we should be able to address. Not everybody will be able to use the mobile phones, but I think the majority of the population will, which will leave therefore the clerks at the admin team at the hospital to make those calls to those who are not mobile astute. But imagine if you could just pick up your mobile phone just to check what time is my appointment tomorrow, and you can see that on your mobile phone, and maybe your mobile phone even gives you a nudge the week before and the day before just to remind you about your outpatient. And maybe if you need to actually change that outpatient appointment, you can do that on your phone to a time that's convenient to you, so we don't lose the slot. We have quite a high rate of do not attends, so we don't lose that slot. We can put somebody else into the slot. But I completely sympathise with the idea. You've travelled, you've got up, you've made your effort to travel all the way to the hospital to find out for some reason it's been cancelled, and you've not even been communicated to, and that has to be a thing of the past.
You took the words right out of my mouth. 11:31 is our time. More to come right here on the Pulse Radio Show. We want to hear from you. 4341007 and 4341070. You can also send us a WhatsApp at 4341007. And those of you listening online, we're glad to have you. We'll take a quick break and be right back with more on the QEH Pulse Radio Show.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Back with you on the Pulse Radio Show. So much to discuss as we continue to share the 2025 to 2028 strategy led by Mr. Neil Clark, our Chief Executive Officer, who's right here with me, and the executive team, and how it works best for you. You have been feeding into the strategy as well. Those of you who attended the public town hall in person and online, we have those comments there. You can go back if you didn't have an opportunity to get to the public town hall or to hear any of the points shared there. You can always go to our website at QEH Connect to take a second look to hear what exactly we have planned for our hospital. You hear me say our hospital all the time because it's my hospital, it is your hospital, it is our hospital, and we want to make sure that it works best to meet your demands and to serve you. We were talking about some of that feedback from the town hall, and I know the callers have been sharing, funny enough, some of the same feedback that we would have heard at the town hall. Speaking about that feedback, what are some of the other things that struck you as we had some comments from our audience then?
So, I mean, the two comments that struck me the most at the feedback from the town hall was about outpatient waiting times and scheduling, and also about theatres and getting operations and people waiting for their operations. And in both cases, people saying they've been cancelled and rebooked, and for both outpatients and for inpatient theatres. I know that we've got a new theatre users committee established by our Director of Medical Services, Dr. Chase, and that committee, headed by Dr. Ford, is looking at how we make the theatres more efficient and run smoothly, so we better understand what creates a cancellation or what stops us making maximum use of those theatres. That they're putting a lot of work into understanding the flow and the different elements that contribute towards having the theatre ready and having the patients ready for theatre, and they've done a lot of documentation on that, along with identifying their own key performance indicators so they can demonstrate it. So I think going forward into year two, as the public were bringing to our attention at the end of year one, we need to move faster with the scheduled appointments, outpatients or theatres, and manage those more effectively. Again, having the health information system will be a big assist to us, because at the moment this data, if you think about it, manual data on different folders and books and spreadsheets and notebooks, for different consultants and clinics, trying to bring all that together to make sense of that, to ensure we can get the most efficient and optimum use of those clinics and of those theatres is a real challenge. So the digitisation is going to significantly support us on that journey. And then I hope when we come back to the end of year 2, we can be giving some good news stories on progress we've made on those 2 particular areas, which I think were probably the ones that came up the most at the town hall we just had.
And then something that you would have mentioned, something I always say on the heels of what you would have said, the suggestion about parking. As simple as that sounds, parking is a real issue for us at our hospital, and it's something that was raised by a member of the public, and you included it in the strategy.
Yes, so when we wrote the strategy initially, car parking wasn't in the strategy, and the whole point of having the town halls is to listen to what people say and see what we've missed and add that in. So we wrote our first strategy that we shared with the staff and with the public, and both the staff and the public raised something that we didn't have in the strategy, and that's, as you say, car parking. So what have we done about that? Well, we did a full feasibility study of what car parking spaces have I got, where are those spaces, how can I create more spaces, and that paper went to the board and got approval from the board to move from doing a feasibility study to actually now identifying firm solutions. We're currently in discussions with an external partner to look at a multi-storey car park, and that's something that we would need to work more on and get that firmed up. But hopefully we can start to identify what the options are for having a multi-storey car park to support the QEH. In the interim, as the NMOD bill comes across, we're probably going to have some further challenges on car parking as we lose space on the other side of the road. So it's not going to be an easy journey for car parking for the next few years. But if we don't start to address that, then obviously we will never come to a finish line for that. So I just want people to be assured that we are cited on the car parking challenges, and we are in discussions to find solutions to address that.
Indeed. We have another caller on the line. Welcome, caller, to the Pulse Radio Show.
Yeah, good morning, Shane, and to the CEO.
Good morning.
You have the 2 answers there, you know.
Yes?
Yeah, your name, spell it out. You put the seal on every movement, and the CEO check every outpatient.
Okay. I like that. I like that.
But my that's off the hook, Shane. But my problem with I spent 6 weeks in the hospital there, and my experience wasn't nice. Especially when I had to go in the outpatient. I remember my wife would tell you, I had problems with my shortness of breath, and I spent 8 hours up on the top floor, then to hear that I have to go to the bottom floor. And I told everybody I would have died, and I would say died of natural causes. That's the problem I have there, and I'm going to suggest how could help the A&E. I suggest it all the time. I don't know if you get rid of having that air condition so high, we're going to walk with blankets. And then, to take the doctors away from the A&E, what are you going to leave the people in the A&E to do? Doctors should be on standby, because you know you're going to have a patient coming in with asthma or gunshots or those kind of wounds. I'm tired of hearing the solutions all the time, when the solution is right there in your face. You just have doctors in place for that, and leave the doctors that are on the A&E. You agree with me or not, Shane? That's a simple solution. I call him with that every day.
I want you to be clear about this suggestion. I want to understand what you would like to see. What is your idea?
I told you that instead of, when you're going to get patients coming in with asthmatics or with gunshot wounds or whatever, and the people from A&E would have to leave and go over there and tend to them. Keep doctors on standby for that.
So I would let the CEO give you a rundown generally of how the operation stands currently in terms of responding to situations like what you would have described.
Yeah, so we have a number of doctors on shift at any time at different levels, and those doctors are spread across the A&E department. Some will be looking after minor illnesses and minor injuries. Some will be in what they call the majors area, the people who are more acutely ill, and some will be allocated over to the resource area for the gunshots or the likes. And that team is spread across the whole of the department, looking after different patients. And as you know, and we've spoken before, every patient who arrives at A&E is seen by the triage nurse and categorised as to the urgency of what they need to be seen, which also identifies where they will go within that department. If we have a high number, an influx of gunshots or a major incident, we have plans, which includes a call out of the doctors to bring in additional resources to do that. So we already have that. Sometimes the challenge is there are not enough doctors, A&E trained doctors, to support a sustained period of that. The good news is we've just been recruiting from overseas, and we've identified, I think it's 6 more A&E doctors. And that 6 more A&E doctors will make a difference to that department in strengthening it, in having obviously 6 more doctors available to help support those 24/7 shifts. And the additional good news is we now have nurse practitioners, and nurse practitioners can work in the A&E department and support patients with mild asthma attacks or mild conditions, and they can work there independently alongside the A&E doctors. So we're strengthening the number of people who can provide that direct clinical input, and we are always reviewing our escalation plans. And Dr. Cruikshank, our head of department, will know we've had a number of discussions about how can we identify more people if there was a major incident. How can we capture every single phone number of every single doctor who might be available to come in and support the QEH in a major incident, but also how can we identify those who, because we often find in a major incident people step forward, but how can we find those who will come forward for extra shifts on a Sunday afternoon or a Monday evening if we've got higher number of patients or higher categories of ill patients. So we keep an eye on that closely, but I think having the nurse practitioners in A&E will be a great benefit to us, and having the 6 new A&E doctors will also be a significant benefit to us. And in my 2 years here, been here just over 2 years now, we haven't recruited 1 new A&E doctor. So I'm really pleased that now we've found 6.
Problem, Shane. You all say that if the case is not serious, that you could go over to any of the polyclinics. But still yet, when you get a prescription, they cannot be filled at the hospital. That needs changes.
Oh, you mean
I had an experience with that already.
If you have a prescription from the polyclinic,
from the polyclinic, it cannot be stay at FD polyclinic. No, but you can't carry it over by the hospital and get it.
So the good
that needs changes.
Yeah. So the good news there is that we are in discussions with the Barbados Drug Service and the Ministry of Health about how we can better support dispensing of medications across the whole system. So the QEH, the polyclinics, and maybe even also the private pharmacies. So there's early discussions there, but I completely understand that frustration, and I would even say, should the QEH be dispensing medications for outpatients, or could they be dispensed nearer to your home in a local pharmacy? So there's a discussion happening as we speak about what the future dispensing arrangements might be like to support you. The last thing you want to be doing is having to move to different locations to pick up your medications, or having to return back to the QEH to get your refill. So we're having those discussions right now.
I have a problem.
In the ED, the Accident and Emergency Department, I've seen more people calling me personally, and calling our Patient Advice and Liaison Service and inquiring about coming to the Accident and Emergency Department. I think people hold more confidence than you may believe in the QEH and by extension the AED, especially when a lot of the other institutions end up sending them and saying, we can't do any more for you, you need to go to the Queen Elizabeth Hospital. So it's the Queen Elizabeth Hospital that the population generally has to lean on for emergency services, and that's not changing anytime soon.
And those staff in that department work so hard and are so dedicated. They really want to get it right for you. Now, I know that doesn't always happen, but the vast majority of people have a good experience and we get it right for them. But of course, every time we get it wrong, it disappoints us and we want to do better.
Indeed. We have another caller. Thank you for calling the Pulse Radio Show. How can we help?
Good afternoon.
Good afternoon.
Yes, I'm calling about. I want to know if there's a maximum time for waiting list for surgeries at the hospital.
A maximum time?
There isn't a maximum time, and at the moment, I'd say there's a further challenge not only not having a maximum time, because we should have a target. So what's the maximum time? At the moment, I couldn't tell you what that maximum time is, because as I said before, that data is held in multiple different locations and not centralised or digital. So I would have to ask at any particular one day somebody to go and gather all that information together, and that from all the different doctors and all the different specialties, and by tomorrow that list will have changed again, because it's dynamic, of course, it's dynamic. So that's why I'm so excited about getting the health information system, so I can see that data, I can see where those long waits are, and then we can do things with that. If I know that the longest waiter is in one particular specialty or one particular doctor, we can work out how we can help drive that one forward to bring that waiting list down and equalise those waiting lists. So at the moment, we're kind of driving blind on this one. But this year, that information will start to come together, and then we'll be able to start to manage that and then have those targets put into place. I would hate to say what that target might be now, because until I see the data. But clearly, we would want most people to be getting to theatre within months, not years. And we wouldn't want anybody to be waiting, over a year. But I don't know the data at the moment because it's not available to me.
Okay. Because the reason why I'm asking this, because I have been waiting for surgery for 3 years, and it has been very frustrating. Honestly, it has been very frustrating. This is a hip replacement surgery. I've been waiting for 3 years, being postponed, and then I had the surgeon, and I was told that he's retired, and I was put on to a different surgeon, and I've been put on to another waiting list. So this is very frustrating for me.
It would be. That's in these cases, especially when these are very individual cases. I would like you to leave your contact information with our producer, Derry Boyne, and we will have our representative from the Patient Advice and Liaison Service respond to you as soon as possible, because
I agree. That seems like an excessive wait, and I would love to understand what's happened on that period. At some point,
my body's knee is out of alignment now because I'm not walking the way I was supposed to walk and stuff.
Yeah. As Shane said, leave us your details so we can investigate that. That is an excessive wait. We need to investigate that and find out. I mean, at this point in time, do you know, have you been given a surgery date, or you haven't got a date at the moment?
No, I've never been given a surgery date. Just being appointments.
Okay. Because we have a pattern here, don't we then? So I'm wasting outpatient appointments, seeing you time and time again, but not stepping forward and doing the treatment. So we either need to agree to take you to theatre and do the treatment, do the hip replacement, or they need to agree that you're not fit for the hip replacement, or whatever the case may be. But we need to conclude, and I think this ongoing running around for 3 years, I need to understand that better. So we'll capture your details. If you leave those with the producer, we'll capture your details and we'll investigate that and come back to you directly.
We really want to be able to give you some guidance going forward. So please, as the CEO just said, leave your details with Derry Boyne, our producer, and we will have our PALS desk, Patient Advice and Liaison Service desk, reach out to you.
Okay, thank you very much.
Not a problem.
So can you imagine, Shane, in the future, when we have that data, and we've been building these dashboards and with the limited data we have, and then we'll have a dashboard which is showing me what's the average wait, what's the longest wait, by specialty, by clinic, by doctor, and how that information will be so valuable for us to understand where those real challenges are, because it's really it feels at the moment a real challenge to understand this without that data.
So the data gives you power of intervention.
Absolutely. And in the past, and I've been in hospitals where we've had similar problems, long waiting lists, but often what you'll find is there might be one long waiting list with one particular doctor in a specialty, but there's another doctor in the same specialty who's got quite a short waiting list. And the issue then becomes, do we swap and increase his outpatient appointments clinics, give him more outpatient appointments, or reduces outpatient appointments who takes on no new patients whilst we equalise those waiting lists out. So there's lots we can do about this once we have the data, and that's why again I keep saying this health information system will be a game changer for the QEH as we get the information and we can see where those delays are, and we can see all the data of all the clinicians and all the different specialties, and then we can really focus, because at the moment you think about it, we're balancing multiple specialties trying to get access to the theatres.
Yeah.
And how do we prioritise that without having the information to do that?
And now we do have more theatre space after we did a big overhaul on the AC units to make sure that our doctors and those patients are comfortable in that space. So the theatre space is all about management going forward now and intervention. Good morning, caller. Welcome to the Pulse Radio Show. How can we help?
Good morning.
Good morning.
I goes to the ENT doctor because I have a thyroid, and I was going there for the last 3 years, waiting for surgery, goes on the appointments when they call me to get it. Twice I went up, was admitted from downstairs up to, I think it's B8, sat down all day long from about 6:30 to 4 o'clock to tell me that that I'm not going to get the surgery that time. Anyway, from that time onward, I be still going to Dr. Ford, get the appointments and everything. Then they said Dr. Ford not going to be in, he's out on vacation. And then I get another appointment after for 3-4 months after. And I want to know if anyone can address that problem, because why would I have to wait again for another 3 months? They don't put you then for the next month, because the next 2 months is all full up already, and then you have to wait 3-4 months again for another appointment. So I'm at that stage now, waiting again.
Yeah, and that is not right. Something that we want to again apologize for. And same as the last caller, it is these individual circumstances that we like to investigate and get to the bottom of, so that we can direct you and basically help walk you through the process. The hospital and the QEH can be sometimes difficult for anyone coming for the first time navigating. You now have been in this situation for years, which is way too long. So we want to help you, even at this point in time, navigate the system. So again, please leave your name with Derry Bowen, our producer, so that we can respond to you as soon as possible. Our patient advice and liaison team will give you a call hopefully later on today.
Okay.
Thanks for calling, though. And it's these types of stories that we need to share then to explain, as you said, CEO, how these improvements which are under the strategy will help to address these individual issues.
And I think this is exactly what the Theatre Users Committee is looking at. How are we scheduling patients into theatres? Who are we prioritising gets the theatre? How do we decide who gets in to have the theatre done? But equally importantly, the point she made there about, she spent the whole day to get the operation cancelled later on that day. Now that shouldn't happen. So ideally, patients get cancelled for 2 reasons. One of them is because they're not clinically well enough to go to undertake the theatre, to manage the surgery, but that should have been identified earlier. And one of them is because something wasn't ready, aligned, in place for that. Of course, occasionally there may well have been a trauma has taken the list, but generally speaking, that's a separate theatre. So we need to make sure that we have the right information and the right systems and processes to manage these theatres, and that's exactly what the Theatre User Committee is tasked with doing, and that's what they've started to do, and to put in their KPIs. I would also expect if somebody's got their theatre cancelled, which shouldn't be at the end of the day, we should have probably known that earlier on in the day, if that gets cancelled, then ideally you should be leaving with a new date. And not looping back round the whole system starting again. So again, we know there's a lot of work to be done here. I know that we spent a lot of the time last year looking at the A&E flows and blockages, and really now we're having a good deep dive into theatre flows and blockages, and we need to start picking up equally that on the outpatient scheduling and the flows and the cancellations, etc., that are happening for those areas. So we've got a busy year 2 ahead of us. And that's great, because I like to be busy, as you know, so that's great news. And we've got to make sure that we come back at the end of this year too. These are the issues that you've raised. Here's what we've done to address them.
Yeah, your team as well, including the Chief Operations Officer, Acting Louise, Bob, and all of the executive directors will be busy making sure that the elements of the strategy, all elements, are covered. And we will go through them piece by piece as we move up to 2028. Let's go back to the phone lines. We have another caller here on the QEH Pulse Radio Show. Welcome. If you can, please turn down your radio in the background so you can just hear us on your phone line, and you can tell us how we can help you.
Welcome. Good morning.
Hi, good morning.
Hi, Ken.
Hi.
Happy again. Angeline here again.
Hi, Angeline. How you doing?
I'm doing good. How yourself?
I'm well.
I know, so you're doing a fantastic job over there.
I appreciate that.
Yes, most welcome. My solution is that is how it's about, but we have care system. It's always a need and consistently to revalidate and to increase, the system, whereas the equipment, to increase the resources more, in patient's care. And, look at the long waiting process. So this is all go with staffing as well, too. And if you do not have the tools, as I always say, you can't function.
Understood.
And
so more resources.
I'm now talk about prescription. Well, we all aware that, the vote for the hospital, where money is concerned, and the polyclinics, they do not marinate together. But I would like that to look at now this new trend, new climate change, whereas the hospital should look at consider taking polyclinic prescription. Because polyclinic, the hospital does not take polyclinic prescription, while the polyclinic takes the hospital prescription. And as I mentioned, it might be different to your all. I know it's all about vote. So, on these things. So you're able to better explain to the patient why that it don't work like that.
Yeah, and I will let the CEO, because he just spoke about that. You were probably calling. You were probably calling when he was speaking about the discussions that are ongoing between the polyclinics and the QEH and really the entire healthcare system and officials connected to it, about how we can better accommodate patients on both ends of the scale, especially if you're transitioning from one place to the next. For example, as you mentioned, from the polyclinic to the QEH. Right, CEO?
Absolutely. So I mean, every service that we provide should wrap around the patient. I know people say that and people think it's just a word, but the reality is it should. If you've got to return to the QEH just to pick up medications and you live far away, it's an added burden on you. And what happens if then you don't come, and therefore you don't take your medications, and then you become ill and you come back into the hospital again? So when we see these challenges of these systems that we've got in place that don't work in the benefit of the patient, it's up to us to unpick them. And we've started that. And Minister Cummins is already leading a piece of work for us and with us on how can we better keep people out of the QEH who don't need to be there and provide services for them nearer to their homes. So how can the QEH better work with the polyclinics, and how can the dispensing be driven out into the polyclinics and maybe even in the future to the private clinics, so you can pick up your medications where it's convenient for you to do so, as opposed to having to come all the way in to the QEH. We've always got the home delivery service for those who don't want to come in.
536-4804. Please connect to that. And it's something that we'll be focusing on going forward in terms of getting more subscriptions to the medication delivery service to make it more convenient for you to get your medication. You don't even have to come into the hospital. You sit down at home or your workplace or wherever you want it to be delivered, and it will be delivered to you Monday through Friday. Something that I guess we need to work on, CEO. If it is more convenient for weekends, we need to have a courier that will meet that obligation for those who want to have their medication delivered to them on weekends.
For sure.
A work in progress.
So we just talked 5 strategic pillars, 25 strategic objectives, 92 strategic initiatives are all in that strategy. And we're moving into year 2, and we've heard and we spoke again about some of the things that we need to drive harder in year 2, and we're looking forward to that challenge, as I'm sure my team is. And Shane, I know you're going to bring the directors here over the next few weeks, and they can talk specifically about their own particular areas of responsibility.
Indeed. All of this is a hospital getting better together with the people of Barbados. Thank you for joining us for Episode 1, Season 5 of the Pulse Radio Show. If you want to catch us again, you can catch us right here on Q100.7 FM. They air this program, re-air it, I should say, later on tonight, so you can join them for that. Also, you can catch us online as well. So a day after the program airs, you can get it on demand on our website, QEH Connect, it will be available there. Thank you for joining us. We will see you next week as we get into another interesting, informative discussion on the QEH Pulse Radio Show right here on Q100.7 FM.
The Pulse Radio Show was brought to you with the compliments of MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Jemmets Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.